Welcome to the deep dive. Today, we're unraveling a puzzle that, well, you might never have heard of it, but it profoundly impacts the global dairy industry: bovine mastitis.
It really does.
And here's a surprising fact to start us off. It's actually the most economically devastating disease for dairy farmers worldwide. We're talking an estimated $147 per cow per year globally.
That's huge. And beyond the numbers, it's important to remember it causes significant pain and discomfort for the animals themselves.
A truly pervasive challenge, then. It seems to really illustrate that intricate dance between animal health and, well, sustainable production.
Absolutely.
So what exactly is bovine mastitis? Can we get a simple definition?
Simply put, yeah. It's an inflammation of a cow's mammary gland,
Yeah.
the udder. It's usually caused by bacterial infections.
Usually bacteria.
Mostly, yeah, though physical trauma, like an injury, can certainly play a role too.
And it sounds like it's not just one thing. It can show up in different ways.
Exactly. It ranges from mild, almost invisible forms right up to severe systemic illness where the whole cow is sick.
Okay, so our mission today is to really pull back the curtain on this complex world. We want to explore its many causes, how you spot it, the crucial diagnostic tools.
And the latest strategies for treatment and maybe even more importantly, prevention.
Right. We want to give you a clear, engaging understanding of this challenge and maybe reveal some, surprising facts and connections along the way. Let's dig in.
Let's do it.
All right, let's start with the absolute basics. What are we talking about when we say mastitis, and how does it actually manifest itself in the cow?
Okay, so at its heart, mastitis is an inflammatory reaction. It's happening right inside the other tissue.
Inflammation. Got it.
And it's almost always triggered by microbial infections, those bacteria we mentioned, though like I said, a physical injury can sometimes contribute. It is, without doubt, the most common and costly disease in dairy cattle across the globe.
And it's not just one presentation, right? You said it appears in different forms.
That's right. We mainly talk about two key forms, clinical and subclinical mastitis.
Okay, clinical first. That sounds like the one you can see.
Exactly. Clinical mastitis is the visible kind, what you might, picture. You'd see clear abnormalities in the milk itself.
Like what?
Oh, things like clots, flakes, or the milk might look watery, yellowish, maybe even bloody. And the udder itself shows those classic signs of inflammation.
Swelling, heat.
Swelling, heat, redness. It might feel hard to the touch, and the cow will definitely be in pain.
Ouch.
Yeah. And in severe acute cases, you could even see systemic signs. That means the cow is sick all over, maybe a fever, loss of appetite, depression, even shock in the worst cases. Unfortunately, it can be fatal.
Wow. Okay, so that's clinical. You can clearly see the symptoms. But you mentioned a hitting form. How does something so impactful go unnoticed, and why is that such a problem for farmers?
Ah, that's the critical distinction. Subclinical mastitis. This is, you could say, the silent assassin on dairy farms.
Island assassin. Okay.
Because there are no visible signs. Nothing obviously wrong with the udder or the milk to the naked eye. But crucially, there's a significant drop in milk production.
Ah, less milk.
Less milk, and a measurable increase in what we call the somatic cell count, or SCC, in the milk.
SCC, somatic cell count. What's that exactly?
Think of SCC as the number of immune system cells, white blood cells mainly, that are rushing to the udder to fight an infection, like tiny soldiers mobilizing in the milk.
Okay, so a high count means infection.
Exactly. And what's truly eye-opening here, and often misunderstood, is that this subclinical form, the hidden one, actually accounts for more financial losses overall than the dramatic, visible clinical cases.
Really? More than the ones that look so bad? Why?
It's because it's often chronic, it lingers, and it's so widespread, it just silently chips away at the farm's profitability day after day through lost production.
So it's this hidden form that can just hang around, causing long-term damage.
Precisely. And that persistent inflammation, going on for months, sometimes with occasional flare-ups where you do see clinical signs. That's what we call chronic mastitis. The cow might not seem obviously sick all the time, but her milk production and quality are definitely compromised.
Okay, so we know what it is, clinical versus subclinical, and that subclinical is a huge, often hidden problem. Let's really drill down now on the burden economically and for the animal's welfare. We started with that $147 per cow per year figure globally. Where do those costs actually hit the farm?
Right. The economic impact is profound. It touches pretty much every aspect of the farm's finances. The biggest slice of the pie, maybe up to 70% of the total losses, comes from reduced milk yield and lower milk quality.
Less milk and worse milk.
Essentially, yeah. When that mammary tissue gets damaged by inflammation, milk production just drops. And the quality suffers because of that higher SCC we talked about. Banks might even penalize farmers for high SCC milk. And remember, it's usually that subclinical form, the one you can't easily see, that's causing the majority of these ongoing production losses.
So it's not just less milk volume, but the milk that is produced isn't worth as much, potentially.
Then you layer on the direct treatment costs. For a clinical case, that can range anywhere from, say, $179 to over $500 per case.
What does that cover?
That includes vet services, diagnostic tests like cultures, and of course the antimicrobial drugs, the antibiotics.
Okay.
Then there's the cost of discarded milk. Cows being treated with antibiotics have a withdrawal period where their milk can't be sold for human consumption. That's lost income right there.
Right, you just have to dump it.
You do. Plus, farmers face increased labor, costs more time spent detecting cases, treating sick cows, managing them separately. It all adds up.
And you mentioned it can even lead to cows having to leave the herd prematurely. Culling, you called it.
Yes, it's a major reason for what we call involuntary culling. The cow leaves the herd not because it's planned, but because she's no longer productive or healthy enough, often due to chronic mastitis. This forces the farm to incur significant replacement costs to bring in a new animal. These culling losses can actually represent a really substantial portion of the total cost per case.
Wow. Okay, that paints a pretty stark economic picture. But beyond the economics, there's the animal welfare side, which is, so incredibly important. This isn't just a production issue, it's about the animal's actual experience. What does a cow go through when she has mastitis?
It's undoubtedly involves considerable pain and discomfort. That inflammation makes the udder swollen, hot, and intensely tender to the touch.
Must be awful.
Yeah, and in those severe clinical cases, the cow can become systemically ill, experiencing things like fever, losing her appetite, just feeling miserable overall. This whole physiological disruption creates immense stress for the animal.
And stress itself isn't good for health, right?
Not at all. Stress further compromises her immune system, making it even harder to fight off the infection or potentially leading to other issues.
And I think you mentioned earlier it can even affect their ability to move around.
Definitely. A heavily swollen, painful udder can genuinely hinder a cow's mobility. It makes it difficult for her to walk comfortably, to stand up, or even lie down properly.
So it impacts her basic behaviors.
Absolutely. And in the most severe instances, mastitis can lead to secondary health problems or, as we said, can even be fatal. It's really a cascading negative effect on their overall well-being.
It really makes you think, doesn't it? When you consider these often hidden costs, both financial and in terms of animal welfare, how might this deeper understanding change the way we, think about the overall sustainability and ethics of dairy production? It's clearly a lot more complex than just a sore udder.
It absolutely is. It highlights the interconnectedness of it all.
So we've covered what mastitis is and why it matters so much. Now let's tackle the central question, the core of this puzzle. What actually causes mastitis? It sounds like it's probably not just one simple thing, one single bug.
You're absolutely right. It's truly multifactorial. That's the key word here. Mastitis is the result of a really complex interplay between three main things: the infectious agents, the cow's own characteristics, what we call host factors, and the environment or management practices on the farm.
A perfect storm, maybe.
Kinda, yeah. Think of it as several elements needing to converge or at least interact to create the problem. And it's rarely just one single cause in isolation.
Okay, let's start with the most obvious culprits then. The microbial invaders. I imagine bacteria are the main players here, right?
Indeed. Microorganisms, primarily bacteria, are the most common cause. They typically invade the udder through the opening in the teat canal.
And how do you categorize these bacteria?
We generally categorize them into two main groups based on how they spread: contagious pathogens and environmental pathogens.
Okay, let's take contagious first. These are the ones that typically spread from cow to cow, probably during milking time.
Precisely. The milking process is the key transmission point. A classic example is Staphylococcus aureus, or Staph aureus. It's very common.
What does Staph aureus do?
It often causes chronic sort of grumbling infections. It's notorious for causing permanent damage to the udder tissue, which means significantly reduced milk output long term. It can be really hard to eliminate from a herd.
Hard to get rid of. Okay, who else is in the contagious group?
Another important one is Streptococcus agalactiae, or strep ag. This one primarily causes subclinical mastitis, that hidden form again. It spreads very easily via contaminated milking equipment or even milkers' hands.
Right.
And both Staph aureus and strep ag and others too are quite clever. They can form these protective layers, almost like a shield or a tiny fortress, called biofilms.
Biofilms?
Yeah.
What do they do?
These biofilms help the bacteria stick to surfaces, like inside the udder or on equipment, and they protect the bacteria from both the cow's immune system and, importantly, from antibiotics. Makes them much harder to treat.
Wow, bacteria building defenses. Okay, what about mycoplasma species? I've heard those mentioned as particularly nasty. A real game changer for farmers, maybe.
They absolutely are. Mycoplasma, particularly Mycoplasma bovis, is profoundly important and, frankly, feared by many dairy farmers.
Why is it so feared?
It causes a very severe form of mastitis that can spread incredibly rapidly through a herd, often affecting multiple quarters in a cow. It leads to significant tissue damage, including fibrosis, which is like internal scarring, and abscesses, which are pockets of pus forming within the udder tissue.
That sounds devastating.
It is. But what's really crucial, the game-changing part, is that Mycoplasma mastitis often shows no response to conventional antibiotic treatments.
No response, so antibiotics just don't.
Often, yes. Or the response is very poor. This forces farmers to consider much more drastic control measures, like identifying and culling infected animals to prevent further spread.
You have to remove them from the herd entirely?
That's often the recommendation, yes.
Hmm.
And another tricky thing is that infected animals can shed high levels of mycoplasma in their milk, even when they look perfectly healthy when they're subclinically infected. So buying an infected animal without knowing it is a common way it gets introduced into a clean herd.
Wow, okay. So that's a huge challenge if your usual antibiotic toolkit is basically useless. Now, let's switch gears to the other group. Environmental pathogens. These are coming from the cow's surroundings, you said.
That's right. These bacteria are basically found everywhere in the cow's environment, in the bedding, manure, soil, contaminated water. They typically get into the udder between milkings when the cow lies down or moves around her environment.
Who are the main culprits here?
Escherichia coli, better known as E. coli, is a very common environmental bacterium. It causes what we often call coliform mastitis.
Coliform mastitis, is that usually severe?
It often is, yes.
Yeah.
E. coli infections tend to be acute and clinical. They can range from relatively mild udder inflammation to very severe systemic illness, and unfortunately can sometimes lead to complete loss of milk production in that quarter or even the death of the cow.
And E. coli is particularly dangerous because it's linked to something called endotoxemia, isn't it? Can you explain that?
Yes, absolutely, and this is a critical point. E. coli and other bacteria called gram-negatives like Klebsiella have a component in their cell walls called endotoxin, or LPS, that's short for lipopolysaccharide. When these bacteria die and break down, they release large amounts of this LPS directly into the bloodstream.
Okay, so the toxin gets into the blood. What happens then?
This triggers a massive body-wide inflammatory response. It's like the immune system goes into overdrive. This leads to the severe systemic signs we see: high fever, rapid heart rate, rapid breathing, severe depression or lethargy, sometimes diarrhea, cold extremities like ears and legs, and in the worst cases, circulatory collapse and shock.
So it's the toxin release that makes the cow so sick systemically.
Exactly. The milk itself might also appear very abnormal watery, maybe with clots, sometimes yellowish or even reddish. It's the systemic effect of the endotoxin that can be so rapidly devastating and life-threatening.
That sounds incredibly serious. What other environmental bacteria should we know about?
Well, Klebsiella species, which we just mentioned, are often found in organic bedding materials like sawdust, especially if it gets wet. They can also cause severe mastitis, sometimes leading to chronic infections and long-term milk reduction.
Okay.
Streptococcus aureus is another very common environmental strep. It's often associated with recurrent mastitis, meaning it keeps coming back. It can also form those tricky biofilms we talked about, and it's found widely in the cow's environment and even on her skin and other body sites.
So it's everywhere.
Pretty much. And then there's Truparella pyogenes. This one is often associated with a characteristic foul-smelling, pus-filled discharge, like abscesses in the udder. It particularly affects young cows, heifers, or cows during the dry period. It often results in permanent damage and loss of function in the affected udder quarter.
Foul smelling. Ugh.
Yeah, it's quite distinct. And interestingly, flies, particularly the horn fly, can act as vectors for Truparella, mechanically carrying the bacteria from infected discharges to the teats of other animals.
Flies spreading mastitis, another complication.
Indeed.
So it's clear the bacteria are major players, and those endotoxins from gram-negatives like E. coli are especially dangerous. But you said it's multifactorial. What about factors that aren't infectious? Things that just make a cow more likely to get sick in the first place?
Right, this is where the multifactorial aspect really comes into focus. These are
Yep.
predisposing factors. Physical trauma, for instance, a direct injury to the udder, getting stepped on, bumping against equipment can cause inflammation and create an entry point for bacteria.
Makes sense.
And then hygiene is huge. Poor hygiene practices are a major risk factor. We're talking about inadequate cleaning in the milking parlor, dirty floors, persistently damp or soiled bedding where cows lie down, exposure to mud and manure.
Why is bedding so important?
Because remember, the teat canal, that opening at the end of the teat, remains partially open for about 15 minutes, maybe longer, after milking finishes. If a cow immediately lies down in a dirty, contaminated environment during that vulnerable period,
Bacteria can just walk right in.
exactly, it provides a direct route for environmental pathogens into the udder.
And what about the cow herself? Her own body, her genetics, do they play a role in her susceptibility?
They absolutely do. These are the host factors. Genetics is one. Some studies suggest that very high-yielding breeds, like the Holstein Friesian, which dominates many dairy industries, seem to be inherently more vulnerable to mastitis.
Interesting. Higher production equals higher risk.
It seems there might be a link, possibly related to udder conformation or immune function trade-offs. Udder structure itself matters too. Cows with very large pendulous udders or teats that are funnel-shaped or have damage-like lesions are at greater risk. Even having a non-functional or blind quarter can increase risk in the others.
What about age?
Age is definitely a factor. Older cows are generally more susceptible than younger ones, partly because their teat canals might become wider or not close as effectively over time after multiple lactations.
And I can imagine the period around calving must be incredibly stressful for a cow. Does that make them more vulnerable?
Immensely so. The transition period, that critical window about 3 weeks before calving to 3 weeks after, is physiologically demanding and highly stressful. Hormonal shifts, metabolic changes, the onset of lactation. It all puts strain on the cow and temporarily weakens her immune system.
Making her an easier target for infection.
Precisely. It's a period of heightened susceptibility. And generally speaking, any factor that compromises a cow's overall immune system status, maybe due to other diseases or stress or nutritional deficiencies, significantly increases her risk of developing mastitis.
So nutrition comes into play too. How does what a cow eats affect her udder health?
Absolutely critical. Nutritional factors are key. An energy and protein imbalance, particularly a negative energy balance right after calving, where the cow is using more energy-producing milk than she's taking in from feed, that directly leads to immunosuppression.
So not enough fuel weakens the defenses.
Exactly. Deficiencies in specific minerals and vitamins are also important. Trace elements like selenium, copper, and zinc, and vitamins like A, C, and E are all crucial for proper immune cell function and antioxidant defense within the udder. If the diet lacks these, the cow's ability to fight off infection is impaired.
What about things in the feed, like toxins?
Yes, mycotoxins, toxic compounds produced by molds that can sometimes contaminate feed ingredients like grains or silage, are another concern. They can reduce the cow's appetite, impair nutrient absorption in the gut, and directly suppress the immune system, indirectly making her more prone to mastitis.
Okay, that covers the cow and the bugs. Finally, how do the day-to-day management practices and the overall environment contribute to this complex picture?
These are hugely influential. The milking routine itself is critical. Inconsistent routines, poorly maintained or malfunctioning milking machines, or milking procedures that cause pain or stress can all damage the delicate teat tissue and increase infection risk.
Machine maintenance seems key then.
Vital. Things like incorrect vacuum levels or pulsation rates can injure teat ends. Housing conditions are also paramount. Overcrowding increases stress and contact between animals. Dirty or perpetually damp bedding, as we discussed, creates an ideal breeding ground for environmental pathogens. Poor ventilation can lead to high humidity and ammonia levels, further stressing cows and favoring bacterial growth.
And flooring.
Even flooring type can play a role. Hard, abrasive concrete flooring, especially without adequate bedding, has been linked to higher rates of lameness. Lame cows tend to lie down more, increasing udder exposure to dirty environments, and the stress of lameness itself can impact immunity. So there's an indirect link there too.
Fascinating. What about just general stress?
Any kind of stress from poor handling techniques, loud or intimidating noises in the parlor, social stress from mixing groups can inhibit milk letdown during milking and generally compromise the cow's immune defenses, making her more susceptible.
And I recall reading somewhere, maybe controversially, about a link to the use of RBST, a growth hormone.
Yes, some studies, particularly earlier ones, did indicate a potential link between the use of recombinant bovine somatotropin, or RBST, and a moderate increase in the incidence of clinical mastitis. The mechanisms aren't fully clear, possibly related to increased milk production stressing the udder, but it's something that has been reported in the scientific literature.
It really makes you think, doesn't it? How incredibly interconnected all these factors are. When you realize something as seemingly simple as a cow's diet, or the type of flooring in her barn, or how she's handled, can directly impact her ability to fight off an infection like mastitis, it's quite the web.
It truly is. Understanding that Webb is the key to effectively managing and preventing the disease.
So we've laid out that complex web of causes. Now let's turn to the really practical side. How do farmers and veterinarians actually identify mastitis once it's taken hold? And then what do they do about it? What does it look like when a cow actually has it?
Right. Recognizing the signs is obviously the first crucial step. For clinical mastitis, the one you can see, the signs are usually quite clear, though they vary in severity.
What are the telltale signs on the udder itself?
The affected quarter, or sometimes the whole udder, will appear swollen. It'll feel hot to the touch compared to normal tissue. It might look red and feel hard or firm instead of soft and pliable. And it's definitely painful. The cow might kick out or react defensively if you try to touch it.
She might resist milking then.
Oh, absolutely. Milking can be very uncomfortable or painful for her.
And the milk itself, you said it changes.
Yes, the milk is the other key indicator for clinical cases. It will look visibly abnormal.
Hmm.
It might be off-color watery, perhaps yellowish, sometimes even pinkish or bloody if there's tissue damage. And you'll often see visible abnormalities suspended in the milk, like fibrin clots, flakes, or even strands of pus.
Doesn't sound appealing.
Not at all. And typically, there will be a reduced amount of milk, or sometimes no milk at all, coming from that affected quarter. In some specific cases, like with that Truparella pyogenes we mentioned, there might even be a noticeable foul-smelling discharge mixed with the milk.
Okay, so those are the local signs in the udder and milk. But in severe cases, you said the cow gets systemically sick beyond just the udder.
That's right. Particularly with acute infections caused by bacteria like E. coli or Klebsiella that release endotoxins. You'll see systemic signs indicating the whole body is affected.
Like what kind of signs?
A high fever is common. The cow will often lose her appetite, become listless or depressed, maybe stand with her head down. Dehydration can set in quickly. Sometimes digestive disorders like diarrhea occur. In the most severe instances, it progresses to toxemia or bacteremia, meaning toxins or bacteria have overwhelmed the system and entered the bloodstream, leading to shock, collapse, and potentially death.
A very serious situation then.
Extremely serious. Requires immediate and intensive veterinary intervention.
But what about that hidden subclinical mastitis we keep coming back to? How on earth do you know a cow has it if there are no visible signs like swelling or bad milk?
That is the million-dollar question, isn't it? And why it's so challenging. With subclinical mastitis, by definition, there are no visible signs on the udder or in the milk that a farmer can just see during milking.
So what are the indicators then? How do you find it?
There are really two key indicators. One is a significant, but often gradual and therefore unnoticed, decrease in milk production from that cow or specific quarters. The other and the most widely used diagnostic marker is that elevated somatic cell count, the SCC, in her milk.
Back to the SCC. So a high SCC is the main clue.
It's the primary tool for detecting subclinical mastitis at the cow and herd level. The higher the SCC, generally, the more severe the underlying inflammation and infection, even if you can't see anything wrong.
So if you can't just look and see it, how do you diagnose it? What are the methods for peering beneath the surface to find these hidden issues and confirm the clinical ones?
Diagnosis involves a combination of approaches, starting right there on the farm. Careful visual inspection and manual palpation, feeling the udder, are the initial steps for any check.
Yeah.
Milkers should routinely practice foremilking or stripping.
Foremilking, what's that?
That's where they discard the first few streams of milk from each teat onto a dark surface or into a special cup before attaching the milking machine. This allows them to visually inspect that first milk for any subtle changes, clots, flakes, wateriness that signal early clinical mastitis. It's often the first and most effective detection method for those cases.
Simple but effective. And you mentioned the California mastitis test, the CMT, before. That sounds like a key tool for the hidden subclinical cases.
It absolutely is. The CMT is a wonderfully simple, rapid cow-side screening test. You mix a small amount of milk from each quarter with a reagent in a special paddle. The reagent reacts with the DNA from somatic cells mostly those immune cells.
And what happens?
The mixture thickens or forms a gel if the SCC is elevated. The degree of thickening gives you a rough estimate of the SCC level negative, trace 1, 2, or 3. It's excellent for quickly identifying subclinically infected quarters right there in the milking parlor, allowing for prompt action.
Any other on-farm tests?
Changes in the milk's electrical conductivity can also be an early indicator of inflammation and new infections, and some automated milking systems incorporate sensors to measure this.
Okay, so those are cow side checks. For more definitive answers, though, you often need to send samples to a lab, right?
Yes, laboratory diagnostics provide more precise information. Somatic cell count, the SEC, is routinely measured electronically in labs, both on individual cow milk samples for monitoring her health status, and crucially, on the bulk tank milk sample, which represents the commingled milk from the entire herd.
What's a good target for the bulk tank SCC?
Regulatory limits vary, but generally a bulk tank SEC below 200,000 cells per milliliter is considered desirable for good udder health and milk quality. Consistently higher levels indicate a potential problem in the herd.
And identifying the actual bug.
That requires milk culture. Aseptically collected milk samples from affected quarters are sent to the lab, where they try to grow and identify the specific bacterial pathogens causing the infection.
Why is that so important?
Because knowing the specific pathogen, is it Staph aureus, E. coli, Strep Ige, Mycoplasma, is absolutely vital for guiding targeted and effective antibiotic treatment. It helps you choose the right drug and predict the likely outcome. You don't want to be just guessing which bug you're fighting.
Makes sense. And I remember you mentioned Mycoplasma is tricky to culture. What makes it so challenging in the lab?
Yeah, Mycoplasma bacteria are different. They lack a cell wall, and they require specialized growth media and, importantly, extended incubation times, often 3 to 10 days, sometimes longer, before colonies become visible. Standard bacterial cultures might miss them entirely.
So it takes much longer to get an answer for Mycoplasma.
It does, which can be a real problem when you need quick decisions on farm. That's why newer molecular technologies like PCR polymerase chain reaction are becoming increasingly valuable. PCR can detect the specific DNA of pathogens like Mycoplasma or even chlamydia directly from the milk sample, often much faster than traditional culture.
Faster answers? What about blood tests?
Blood tests can sometimes provide supportive evidence, especially in severe systemic cases. They might show changes like a low white blood cell count initially, leukopenia, followed by an increase, or high levels of fibrinogen, indicating severe inflammation in the cow's system.
Okay. So once you have a diagnosis, maybe you know the specific pathogen, how do you approach treatment? It sounds like it's definitely not a one-size-fits-all solution.
No, absolutely not. Ideally, treatment should be targeted, meaning it's based on those milk culture results and sensitivity testing, if available, to ensure the chosen antimicrobial is likely to be effective against the specific pathogen isolated.
So using the right weapon for the right enemy.
Exactly. For severe clinical mastitis, especially those cases with systemic signs, systemic antibiotics, usually given by injection into the muscle or vein, are often necessary to get sufficient drug levels throughout the body. Drugs like ceftiofur or certain penicillins might be used.
And for less severe cases.
In many milder clinical or subclinical cases, antibiotics can be infused directly into the affected quarter of the udder through the teat canal. This is known as intramammary infusion. There are many different antibiotic formulations designed specifically for this route.
But we keep coming back to the fact that antibiotics aren't always the magic bullet, especially for that tricky Mycoplasma, which you called a game changer earlier.
That's the really difficult part. As we discussed, Mycoplasma infections often show little to no response to conventional antibiotic treatments. The bacteria just aren't susceptible.
So what do you do for Mycoplasma mastitis?
For these cases, the focus shifts almost entirely to control and prevention of spread. This involves strict monitoring, maybe using PCR testing, segregation of any infected animals from the main herd, and unfortunately often requires culling, removing infected cows to eliminate the source of infection and protect the rest of the herd. Treatment is generally considered ineffective and isn't recommended.
A tough situation. Beyond antibiotics, what about supportive care? That seems like it would be vital, especially for those really sick cows.
Supportive care is absolutely crucial and sometimes makes the difference between life and death in severe cases. Nonsteroidal anti-inflammatory drugs, NSAIDs like Flunix and Miglumin, are very important.
What do NSAIDs do?
They help reduce the pain, the fever, and the inflammation associated with mastitis, making the cow feel better and helping to counteract the damaging effects of inflammation and endotoxins.
Oh, fluids.
Yes, especially for severely affected cows showing signs of dehydration or shock, like those with coliform mastitis and endotoxemia. Intravenous fluid and electrolyte therapy is often essential to restore hydration, support circulation, and help flush toxins from the system. It's life-saving supportive care.
What about managing the udder itself during treatment? Can you do anything locally?
Yes, good udder management helps. Frequent milking or stripping of the affected quarter, perhaps 3 or more times a day, is often recommended.
Why frequent milking?
It helps to physically remove the infected milk, bacteria, toxins, and inflammatory debris from the udder, which can speed up recovery. Some people also advocate for applying cold therapy, like ice packs or cold water hoses, to the udder in the very early stages of acute inflammation to help reduce initial swelling and pain, sort of like first aid.
Makes sense.
In cases of very chronic mastitis that just won't clear up despite treatment, or if a quarter is permanently damaged, a veterinarian might recommend permanently drying off that infected quarter, meaning treatment is given to stop it producing milk altogether to prevent it from being a source of chronic infection. And of course, providing good overall nursing care and nutritional support is essential to help the cow recover her strength and immune function.
Right. And finally, there's something called dry cow therapy. That sounds like it's both a treatment and a preventative measure, doesn't it?
It is, and it's a cornerstone of modern mastitis control programs. Dry cow therapy involves administering a specially formulated long-acting antibiotic infusion into each quarter of the udder immediately after the last milking of her lactation period, right as she dries off.
Why do it then?
It serves 2 critical purposes. First, it aims to eliminate any existing subclinical infections that might be lingering at the end of lactation. Second, and perhaps more importantly, it helps to prevent new infections from developing during the early part of the dry period.
Is the dry period a particularly risky time?
Yes, the period immediately after drying off and the time just before calving are when the mammary gland is highly susceptible to new infections. The natural keratin plug that seals the teat canal takes time to form properly after milking stops. Dry cow therapy provides protection during this vulnerable window. It's considered a very cost-effective strategy because you're treating infections or preventing new ones without having to discard sellable milk as you would during lactation.
So accurate diagnosis leading to targeted treatment and good supportive care are certainly key pieces of the puzzle. But if we connect this back to the bigger picture, it really sounds like prevention is where the real long-term gains are made, both for the farm's bottom line and for the animal's overall health and welfare.
You've hit the nail on the head. Prevention is absolutely paramount.
That's a perfect segue then. We've talked a lot about identifying and treating mastitis, but as you just hinted, and as we've heard throughout, prevention is almost always far more cost-effective, not to mention better for the cows, than trying to fix the problem after it happens. So what does a truly proactive pathway to good udder health actually look like on a farm?
Prevention is indeed significantly more economical in the long run. And it's not about finding one single magic bullet solution. It requires a really comprehensive, integrated approach that touches on several key areas of herd management simultaneously. It's about building layers of defense.
Okay, let's start with the big picture view. Things like overall herd health programs and biosecurity. How do they fit into preventing mastitis specifically?
They are fundamental. Strict biosecurity protocols are essential to prevent the introduction and spread of contagious pathogens, especially nasty ones like Staph aureus or Mycoplasma bovis.
What does strict biosecurity mean in practice?
It means things like quarantining any new animals coming onto the farm, or cows returning from shows or other farms, until they've been tested and confirmed negative for key contagious pathogens. Milk samples should ideally be cultured, maybe even PCR tested for Mycoplasma, before these animals join the main herd.
So controlling who comes in.
Yes, and limiting contact between your herd and outside animals or visitors who might carry pathogens on boots or equipment. It also involves routine, rigorous cleaning and disinfection of equipment, tools, and facilities, paying attention to details like thoroughly cleaning calving stalls between each use.
Right, stop pathogens from getting a foothold anywhere. What about waste milk from cows that are infected or being treated? You mentioned that earlier.
Yes, that's a critical biosecurity point, especially regarding Mycoplasma bovis. Milk from infected or treated cows should absolutely not be fed raw to calves, as this is a major route for transmitting the disease to the next generation. If it's going to be fed, it must be properly pasteurized first to kill the pathogens.
Okay. Any rule for vaccines?
Vaccination can play a role, yes, but it's generally considered part of a broader control strategy, not a standalone solution. There are vaccines available, for instance, core vaccines targeting E. coli and other coliforms to reduce the severity of clinical signs associated with endotoxemia. There are also some staph vaccines, though their effectiveness can be variable. It's another layer of defense, used in conjunction with good management.
Got it. So biosecurity is about keeping bugs out and preventing spread. Next up, the milking process itself, hygiene and routine. This seems absolutely fundamental, but what are the non-negotiable steps there?
It is fundamental, probably the most critical control point for contagious mastitis, and important for environmental too. First, cows' udders, especially the teats, should be visibly clean and dry before the milking unit is attached.
Clean and dry. What else?
Teat dipping is crucial. Using an effective, approved germicidal teat dip before milking called pre-dipping helps to kill bacteria already present on the teat skin. Then, just as importantly, using a post-milking teat dip after the milking unit comes off is vital.
Why post-dipping specifically?
Because remember that teat orifice, the opening, remains relaxed and partially open for about 15 minutes or more after milking, creating that vulnerable window. The post-dip disinfects the teat skin again, kills any bacteria transferred during milking, and often contains emollients to keep the teat skin healthy. Some dips even form a physical barrier over the opening.
Okay, pre-dip, post-dip. What about the order of milking?
A good practice is to milk known healthy cows first, especially first lactation heifers, followed by older cows, and milking any cows known to be infected or treated last. This helps prevent carrying contagious bacteria from infected cows to clean cows via the milking units or hands.
Makes sense. And the milking machine itself?
Proper function and maintenance of the milking equipment is absolutely critical. As we touched on before, poorly functioning machines, wrong vacuum levels, faulty pulsators, worn-out liners can cause significant damage to the teat ends, making them much more susceptible to infection and can also hinder complete milkout. Regular testing and maintenance by qualified technicians are essential.
And what about right after milking?
A common recommendation is to ensure cows have access to fresh feed immediately after milking. This encourages them to remain standing for at least 30 minutes or so, while those teat canals have a chance to close tightly, reducing the risk of picking up environmental bacteria if they were to lie down immediately.
Clever. Keep them standing. Okay, so that's the parlor. Beyond that, the general environment where the cows live must play a huge role, especially for those environmental pathogens.
It absolutely does. Providing clean, dry, and comfortable bedding for cows to lie on is critical. Bedding needs to be managed, meticulously kept dry, regularly replenished or cleaned out. Damp, soiled bedding is just an incubator for bacteria like E. coli and Klebsiella.
What kind of bedding is best?
Inorganic bedding like sand is often considered ideal because bacteria don't multiply well in it and it drains well. Organic bedding like straw or sawdust can work, but requires much more intensive management to keep it clean and dry. Adequate resting space per cow is also important to avoid overcrowding and ensure cows can lie down comfortably in clean areas.
Ventilation, too.
Good ventilation is key. It helps remove moisture, reduce humidity, lower ammonia levels, and generally minimize the airborne pathogen load. Proper climate control is also important. Heat stress or humidity stress can significantly impact a cow's immune system and increase mastitis risk.
In the calving area.
Maintaining a scrupulously clean, dry, and well-bedded calving pen or area is also vital. The transition period around calving is already high risk, so ensuring the environment is as clean as possible helps protect fresh cows from picking up infections right at the start of lactation.
Right, start them off clean. And we touched on nutrition quite a bit when discussing causes. How does that translate into prevention strategies?
Nutritional management is paramount, really, throughout a cow's entire production cycle. It's about providing a consistently well-balanced ration that meets her specific requirements for energy, protein, fiber, minerals, and vitamins, adjusted for her stage of lactation or gestation.
Avoiding those deficiencies we talked about.
Exactly. Preventing both overconditioning, getting too fat, and underconditioning, being too thin, is important, as both extremes can predispose cows to metabolic problems around calving, which in turn suppresses immune function. Ensuring adequate supplementation of those key immune-supporting trace elements, selenium, copper, zinc, and vitamins, particularly A and E, is vital for building a robust defense system within the udder. Avoiding moldy or spoiled feed is also part of good nutritional management to prevent mycotoxin exposure.
Finally, thinking really long-term, what about genetics? Can you actually breed cows that are less likely to get mastitis?
Yes, definitely. Genetic selection is becoming an increasingly powerful tool in the long-term strategy for mastitis control. We can now select bulls and cows, not just for high milk production, but also for genetic resistance to mastitis.
How does that work?
Genomic testing allows us to identify animals that have genetic markers associated with lower somatic cell counts, better immune responses, or reduced susceptibility to infection. Selecting for desirable udder conformation and teat structure, udders that are well attached, not too deep, with properly shaped teats, also helps reduce physical risk factors. So over generations, you can gradually build a herd that is inherently more resilient to mastitis.
So even though high-yielding breeds might have been more vulnerable historically.
Modern breeding programs are increasingly incorporating these health and fitness traits alongside production traits, aiming for a more balanced, resilient cow. It's a slower approach, obviously takes generations, but it's a sustainable part of the solution.
It really makes you appreciate, doesn't it, how this deep dive into prevention reveals such a layered, multifaceted approach. It's clearly not about one single fix, but this strategic combination of so many diverse practices, biosecurity, hygiene, environment, nutrition, genetics, that truly creates resilience within the herd. It's a truly holistic endeavor.
That's exactly the right word, holistic. You have to address all the pieces.
Well, we've certainly taken a deep dive into the world of bovine mastitis today. I think it's crystal clear that this is a formidable, truly multifaceted challenge in cattle production, one that demands a really comprehensive and integrated approach to manage effectively.
Absolutely. Effective management really hinges on, yes, accurate diagnosis and targeted treatment when needed, but as we've emphasized, most importantly, it relies on proactive, multi-pronged prevention strategies.
So to really mitigate mastitis' impact, the economic costs, the welfare concerns, the production losses, requires this holistic understanding of that complex interplay of factors we discussed. The bugs, the cow, the environment. It means integrating best practices across literally all aspects of cattle management.
That's the key takeaway. Enhancing animal welfare, improving milk quality, and ultimately boosting farm profitability all go hand in hand when you effectively control mastitis through this kind of integrated approach.
And, if we connect this to the bigger picture, thinking beyond just mastitis, what's really fascinating here, I think, is how a deep dive into just one single health challenge like this reveals the incredibly intricate and interdependent systems at play in animal agriculture. It's not just about a cow's udder,
Yeah.
right? It connects to genetics, the environment she lives in, her nutrition, how humans manage her, even global economics impacting feed costs or milk prices.
It's all interconnected.
It really is.
Yeah.
So maybe a final provocative thought for you, the listener. What other hidden interdependencies do you think exist in complex systems that you're familiar with, maybe in your work or nature or society? And how might understanding those connections more holistically lead us towards more resilient and ultimately more sustainable outcomes in those systems too? Something to chew on.